All India Radio presents Morning News. Good morning. I'm Anuja Kumar and with me is Sarabjit Kaur. The headlines. Prime Minister Narendra Modi to deliver keynote address at India Ideas Summit today. Health Minister Harshvardhan says N95 masks with respirator valves do not prevent coronavirus. Appeals everyone to use triple-layer mask made of cloth. Government extends work from home for IT and BPO companies till December 31st due to COVID-19 pandemic. Annual Amarnath Yatra cancelled this year due to COVID-19 pandemic. Flood situation deteriorates in Bihar following heavy rains. And US says Beijing is using corona crisis to bully its neighbors and militarize South China Sea. Prime Minister Narendra Modi will deliver the keynote address at the India Ideas Summit today. The two-day summit, which began yesterday, is being hosted by the US-India Business Council. This year marks the 45th anniversary of the formation of the council. The theme for this year's India Ideas Summit is Building a Better Future. A report.
Prime Minister Narendra Modi will provide perspective on how US-India partnership can shape the post-COVID world. The virtual summit will witness discussions on areas including India-US cooperation and future of the relation between the two countries in a post-pandemic world. It will feature high-level presence from Indian and US government policymakers, state-level officials, and thought leaders from business and society. Key speakers at the summit include External Affairs Minister Dr. S. Jaishankar, US Secretary of State Mike Pompeo, Senator of Virginia and co-chair of Senate India Caucus Mark Warner, former US Ambassador to the United Nations Nikki Haley, among others. With Anand Chaturvedi, Suparna Saikia, AIR News, Delhi.
The government has taken continuous efforts for structural reforms in the economy, which will make big difference. Even during the challenge of COVID-19 pandemic, it has announced big-time reforms and made major structural changes in agriculture and other sectors. This was stated by Finance Minister Nirmala Sitharaman while virtually addressing the India Ideas Summit of US-India Business Council yesterday evening. She said the indicators show green shoots in the Indian economy.
The indicators that are before us are very, very clear that the power consumption has increased, toll collection and the roads have increased. Very clearly, the bank operations and their transaction of businesses, particularly the digital mode and not the ATMs, have increased in their traction. Very clearly, these are signs. So I can see that the stimulus that we gave, which has touched about 10% of the GDP, has actually made a big difference for companies which want to come out of the lockdown and the effects of the lockdown.
In his address, Commerce and Industry Minister Piyush Goyal said Atmanirbhar Bharat program aims to prepare India to work with the world on equal terms. He added that the government wants to offer India as a reliable business partner.
We need to work towards a much more sustainable, a much more robust, a much more enduring partnership in the form of a free trade agreement to which India is willing to work with an open mind, with a willingness to open our hearts and our markets with a corresponding opportunity for Indian businesses in the US.
Union Minister of Labour and Employment Santosh Kumar Gangwar has said that the centre is engaged with states to work out a plan on how to ensure benefits of ESIC and Provident Fund to workers engaged in unorganised sector. In an exclusive interview to DD News, Mr. Gangwar said there are about 40 crore workers who are engaged in unorganised sector in the country. He said the Labour Ministry will also have a data bank of the number of workers who have migrated from one state to another state.
हम ये कहते हैं कि 40 करोड़ मजदूर हैं, तो इसका कोई डाटा हमारे पास नहीं है। ये भी हम एक पूरी रिपोर्ट लेने का काम कर रहे हैं। रिपोर्ट हमारे पास रहे कि वास्तव में अगर असंगठित श्रमिक हैं तो कितने हैं, किस राज्य से कितने हैं, कहाँ जाते हैं, किस काम के लिए जाते हैं और कब लौट कर आते हैं, नहीं आते हैं। अब एक पूरा डिटेल हमारे पास आ जाएगा।
Health Minister Harshvardhan has said that N95 masks with respirator valves in them do not prevent the coronavirus from spreading out. He said N95 mask fitted with perforated respirator is contrary to the rules adopted to prevent the spread of coronavirus. In a tweet, Dr. Vardhan appealed to everyone to use a triple-layer mask made of cloth and also to encourage others for this. Director General of Health Services Dr. Rajiv Garg has written to the Principal Secretaries of Health and Medical Education of all the states in this regard. In the letter, Dr. Garg said that the use of valved respirator N95 masks is detrimental to the measures adopted for preventing the spread of coronavirus, as it does not prevent the virus from escaping out of the mask. The Health Ministry in its briefing said recent studies suggest that an asymptomatic person wearing N95 mask can affect others.
N95 मास्क रेस्पिरेटर जिसको वाल्व कहते हैं उसके साथ और बिना रेस्पिरेटर के भी N95 मास्क आते हैं। हाल के दिनों में कुछ साइंटिफिक स्टडीज हुई जिन्होंने ये कहा कि जब आप वाल्व वाला मास्क पहनते हैं तो आप स्वयं तो सुरक्षित हैं, लेकिन जो आप एक्सहेल कर रहे हैं, if you are an asymptomatic person, then the propensity of that infecting others is there. This is a evolving situation.
Participating in AIR live phone-in program on COVID-19, Dr. M.K. Sen, senior physician at Safdarjung Hospital in New Delhi, has talked about various types of face masks available in the market.
मास्क कई प्रकार के हैं, या तो कपड़े का मास्क होता है या फैब्रिक मास्क होता है, या फिर दूसरा मास्क होता है जो डिस्पोजेबल मास्क होता है और उसे सर्जिकल मास्क कहा जाता है। तो हर एक मास्क का अपना अपना स्थान है, कहाँ पे इसका इस्तेमाल किया जाना चाहिए।
All India Institute of Medical Sciences, AIIMS Delhi, in collaboration with Union Health Ministry and Niti Aayog, will start a national program called National Clinical Grand Rounds on COVID-19 from today. The program envisages that every doctor across the country learns and shares their best practices in the treatment of coronavirus patient. Niti Aayog member Dr. V.K. Paul said that COVID-19 pandemic is an evolving situation and this platform will give the doctors an opportunity to share their best practices of treatment. He has appealed to the doctors to maximize their participation in the initiative to collectively work towards containment of the global pandemic in the country. Niti Aayog member Dr. V.K. Paul has said India is the front runner in the development of vaccine and in this journey the country seems to be reaching a good position. He said that the government will leave no stone unturned to ensure that people of India and international community have access to an Indian vaccine. Briefing media in New Delhi yesterday, Dr. Paul said all the regulatory process will be ensured, making sure the vaccine trials are done with scientific and ethical rigor. He said 2 indigenous vaccines have started their human clinical trials. He said top Indian pharma company Serum Institute of India has signed a contract with British drug maker AstraZeneca to supply 1 billion doses of Oxford University's potential COVID-19 vaccine, which is currently at the most advanced stage at the world level.
One of the leading vaccine makers in the country, Serum Institute of India, said it will be starting trials of the COVID-19 vaccine developed by Oxford University and AstraZeneca by the end of August and launch the vaccine by June next year if all goes well. The Pune-based company's chief executive, Adar Poonawalla, while speaking to a private news channel in Mumbai on Tuesday, said the Oxford University has tied up with Serum Institute of India to manufacture and supply the vaccine to India and over 60 other countries having a combined population of 3 billion. More details from our correspondent.
As part of the special permission, the company will manufacture up to 70 million doses of the vaccine per month up to October and plans to take it up to 100 million per month by December so that it is ready to hit the market once the final approvals are in place. Poonawalla said the company is taking a high financial risk by putting $200 million for manufacturing nearly 300 million doses before the final nod to launch the vaccine market, which is expected at best by the end of the year. The vaccine under development will be injected into 4,000 to 5,000 volunteers in Pune and Mumbai, which have high rates of coronavirus infections as part of the crucial phase 3 of the trial, which will determine if the antidote can be introduced in the market or not. Devapriya Bhattacharjee, AIR News, Mumbai.
Passengers arriving in Delhi by international flights will have to undergo a 7-day institutional quarantine at their own cost. The Delhi airport has informed that as per the new guidelines for flight passengers, such international passengers will also have to undertake a 7-day home quarantine after the institutional quarantine. All domestic passengers will have to undergo mandatory thermal screening at the exit gates. You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to deliver keynote address at India Ideas Summit today. Health Minister Harshvardhan says N95 masks with respirator valves do not prevent coronavirus, appeals everyone to use triple-layer mask made of cloth. Government extends work from home for IT and BPO companies till December 31st. Annual Amarnath Yatra cancelled this year due to COVID-19 pandemic. Flood situation deteriorates in Bihar following heavy rains, and US says Beijing is using corona crisis to bully its neighbors and militarize South China Sea. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The government has extended connectivity norms for work from home for IT and BPO companies till December 31st this year due to COVID-19 pandemic. In a tweet last night, the Department of Telecommunications said it has further extended the relaxations in the terms and conditions for other service providers up to 31st of December 2020 to facilitate work from home in view of the ongoing concern due to COVID-19. The time period for work from home was expiring on July 31st. Human Resource Development Minister Ramesh Pokhriyal Nishank has said that the government will ensure that JEE Main and NDA examination dates do not clash. He said representations have been received from many students regarding the clash of dates of the two examinations, and the matter has been examined. HRD Minister said that the DG of National Testing Agency will ensure that the two exams do not clash. Andhra Pradesh government has decided to restart schools from September 5th. However, the final decision will be taken based on the situation when the date approaches. Addressing the media persons after the review meeting on education taken by Chief Minister Y.S. Jagan Mohan Reddy, Education Minister Adimulallappu Suresh told reporters that while the government has set September 5th as the date to reopen the school, Adimulallappu Suresh also added that till the time the schools reopen, dry rations in lieu of midday meals will be supplied to students at their homes. He also said that pre-primary education, LKG and UKG, will be introduced in government schools from the next academic year, and coaching will be provided for competitive exams like AP, EAM, CET, JEE, IIIT, among others in government junior colleges. A seroprevalence study conducted in Delhi to understand the proportion of population exposed to corona infection shows that only 22.86% of the people are affected due to coronavirus. The study also indicates that a large number of infected persons remained asymptomatic. This study was conducted from 27th of June to 10th of July in all the 11 districts of Delhi. It is one of the largest seroprevalence studies conducted in the country using the ELISA testing. The tests have been done to identify the presence of antibodies in the general population. It provided information about past COVID-19 infection in individuals who tested positive.
The National Centre for Disease Control, NCDC, said that 8 districts of Delhi have more than 20% seroprevalence and 77% population is still vulnerable. AIIMS Delhi Director Dr. Randeep Guleria has said that the lockdown has proved to be a very effective tool in containing the spread of coronavirus. Talking to DD News, Dr. Guleria said it has helped strengthening the health infrastructure in the country, including setting up of dedicated COVID hospitals. On the Sero survey report conducted in Delhi, Dr. Guleria said the survey also suggests that there is no community transmission as around 77% of population is protected from the virus.
अगर आप पूरे कंट्री का डेटा देखें तो उसमें कोई ज्यादा एविडेंस नहीं है. आईसीएमआर ने पूरा अपना डेटा सीरो सर्वेलेंस का दिखाया था. देयर आर मेनी स्टेट जहां पे अभी बहुत कम केसेस है. टू से कि वहां पे कम्युनिटी ट्रांसमिशन हो रहा है वुड नॉट बी अ राइट थिंग. बट देयर आर हॉटस्पॉट्स इवन इन सिटीज वेयर देयर इज स्पाइक ऑफ केसेस. एंड दैट इज व्हाई आई केप्ट सेइंग कि जो कंटेनमेंट जोन है उनमें बड़ा एग्रेसिव एक्शन की जरूरत है. डोर टू डोर सर्वे करने की जरूरत है. जिनको भी फीवर सिम्टम्स हैं उनके टेस्ट करो, आइसोलेट करो. उससे आप वहां की जो स्प्रेड हो रही है उसको रोक पाओगे और तभी आपके उस एरिया में केसेस कम होंगे.
Bihar BJP member of Legislative Council Sunil Kumar Singh died due to COVID-19. He was undergoing treatment at Patna AIIMS. Chief Minister Nitish Kumar and Deputy Chief Minister Sushil Kumar Modi have condoled his demise. In view of surge in COVID-19 cases, fresh lockdown restrictions are being imposed in many urban areas of Chhattisgarh. In Raipur, Surguja and Baloda Bazar districts, the 7-day lockdown has been reimposed from today. While in the urban areas of Durg, Korba and Bilaspur districts, the new restrictions would come into effect from tomorrow.
In Madhya Pradesh, there will be a lockdown for 2 days every week, including Sundays in districts with high incidence of coronavirus cases in the state. The number of COVID-19 cases in the state stood at 24,095, while the death toll mounted to 756. As per the State Health Department, all 52 districts have active cases. More details from our correspondent.
During a review meeting in Bhopal, Chief Minister Shivraj Singh Chauhan said that in a bid to prevent coronavirus infection, there will now be lockdown in districts with high infection rate for 2 consecutive days in a week. All activities except essential services will be restricted during this period. The state government has also decided to enforce a night curfew in every district from 8 p.m. to 5 a.m. in view of the rising cases. That 2-day lockdown will include Sundays, but another day, either Saturday or Monday, will be decided by the District Crisis Management Group. Meanwhile, after 64 prisoners were found corona-infected in a jail in Raisen district of the state, the Home Minister Narendra Mishra has now given instructions to send the prisoners to jail only after the corona test. The jailer has also been suspended. Sanjeev Sharma, AIR News, Bhopal.
In Gujarat, the number of coronavirus cases crossed the 50,000 mark. The state reported 1,026 cases in the last 24 hours, which is the highest one-day spike till date. State Health Department said 34 patients succumbed to the virus yesterday, taking the death toll to 2,201. We have a report on this.
This was for the first time that the state reported 1,000 plus COVID cases in a day. Surat reported the highest 298 cases yesterday, followed by Ahmedabad 199, Vadodara 75 and Rajkot 58. With this, the total number of cases in Surat crossed 10,000 mark. As many as 744 COVID-19 patients were discharged from various hospitals in the state in the last 24 hours, following which the recovered cases has increased to 36,403. Currently, there are 11,861 active cases of COVID-19 in the state. Amarnath Yatra, AIR News, Ahmedabad.
The COVID infection is increasing rapidly in Rajasthan. With 983 persons found positive yesterday, the number of active cases has crossed 8,000 in the state. Meanwhile, several important decisions have been taken in the state in the cabinet meeting held under the chairmanship of Chief Minister Ashok Gehlot yesterday. More from our correspondent.
The Chief Minister told that 1,000 rupees will be provided to 35 lakh needy families affected by the lockdown. These beneficiaries include BPL, state BPL, Antyodaya and other construction workers who were not covered under social security schemes. Public transport services will also be resumed in cities with social distancing and other protocols. The cabinet approved a proposal to extend benefits for another 1 year to the units of tourism, hotel and multiplex sector under the Rajasthan Investment Promotion Scheme. A relief package has also been approved of about 220 crores rupees through RICO to give relief to industries. Jitendra Dwivedi, AIR News, Jaipur.
The Uttar Pradesh government has issued a revised discharge policy for patients who have recovered from COVID-19 infection. Now, new guidelines will be followed to discharge any patient in the state, and a dedicated website upcovid19tracks.in has been developed to track the information about patients. We have a report.
Asymptomatic patients staying in home isolation will be considered recovered if they show no symptoms for 10 days, but they will have to stay in home isolation for 7 more days. Mild asymptomatic patients admitted in COVID facility will be discharged 10 days after their initial testing or 7 days after being admitted if they show no symptoms, and they will have to be in mandatory home isolation for 8 days. Samples of mild symptomatic patients will be collected through TrueNat machines on 8th day of a sample. If it comes negative, then they will be discharged 10 days after first sample or 10 days after show of symptoms or 3 days without fever, whichever is later. Sushil Chandra Tiwari, AIR News, Lucknow.
The Karnataka government has decided to supply Remdesivir to private hospitals to check black marketing and hoarding. The decision was taken by the Task Force Committee meeting yesterday. Our correspondent reports approval was given for purchase of equipments and upgradation of existing facilities at government hospitals at a cost of 500 crore rupees.
In Karnataka, 3,649 new COVID-19 positive cases were reported yesterday. Among them, 1,714 cases were reported from Bengaluru. A total of 1,664 patients were recovered from various hospitals, and the total recovered patients has gone up to 25,459. 61 patients succumbed to the disease, and the total deaths increased to 1,464. 44,140 active cases are prevailing in the state. In a single day yesterday, 43,904 swab samples were tested, and the total test has gone up to 10,64,734. The state recovery rate is 35.84% and the mortality rate is 2.06%. R. Murthy, AIR News, Bengaluru.
Tamil Nadu government has announced that the unorganized workers can now join the state-run welfare boards through a dedicated web portal. As there are travel restrictions due to the prevailing pandemic, the move is expected to help thousands of workers. Meanwhile, the total corona infection has crossed 1,80,000 with 4,965 people confirmed positive yesterday. Here's a detailed report on this.
The Tamil Nadu government is running 17 different welfare boards for the unorganized workers. The boards are offering educational scholarships, marriage assistance and skill training to the wards of the members, health facilities and insurance. During the prevailing pandemic situation, those who want to get membership and to apply for benefits find it difficult due to the travel restrictions. Keeping this in mind, the government has formed a secured web portal labor.tn.gov.in through which the services could be easily availed. Jai Singh, AIR News, Chennai.
In our series Expert Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Nand Kumar, Professor of Psychiatry, AIIMS, advised people to stay home, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. Stay at home, spend time with the family, do household work, exercise, listen to music, sing with the family, do yoga, meditation, and take care of emotional needs of the family.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1800 115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:30 p.m. onwards. The annual Amarnath Yatra this year has been cancelled due to COVID-19 pandemic. However, the traditional rituals will be carried out as per past practice without any interruption. The virtual darshan of one of the holiest Hindu pilgrimages devoted to Lord Shiva will continue to be telecast live during the morning and evening aarti. The decision to cancel the pilgrimage to the Himalayan cave shrine was taken at a meeting of Sri Amarnath Shrine Board chaired by Jammu and Kashmir Lieutenant Governor G.C. Murmu yesterday. In Bihar, flood situation has further deteriorated following heavy rains in Nepal and heavy discharge of water from Gandak Barrage. Principal Secretary of Water Resource Department Sanjeev Hans said discharge from Gandak Barrage will be up to 5 lakh cusecs. Surging water of Gandak River is spreading in fresh areas rapidly. 5 areas or districts of Saran, Vaishali, Muzaffarpur, East and West Champaran have been put on alert following heavy discharge of water from Gandak Barrage. Meanwhile, 23 people have lost their lives and 9 injured in lightning and rain-related incidents during the past 24 hours in the state. Governor Fagu Chauhan and Chief Minister Nitish Kumar have expressed grief over the loss of lives. The Chief Minister has announced an ex gratia of 4 lakh rupees each to the next of the kin of the deceased. He has also ordered free treatment to the injured.
In Assam, there is no improvement in flood situation in the state due to incessant rains at some places. The death toll due to floods has gone up to 87. Over 2,000 villages are submerged. Barpeta, Dubri, Golpara, South Salmara, Mankachar are among the worst affected districts. Chief Minister Sarbanand Sonowal visited flood-affected Chirang, Bongaigong and Golpara districts yesterday. Mr. Sonowal instructed officials to do the needful to help affected people. And now let us take a look at the weather updates for today. The national capital Delhi may witness thunderstorm with rain. The minimum temperature was recorded at 23 degrees Celsius while the maximum is expected to be around 33 degrees. Mumbai will have a generally cloudy sky with light rain or drizzle. The minimum temperatures shall be around 27 degrees Celsius, maximum around 33 degrees. Chennai, the temperatures will hover between 28 and 34 degrees Celsius. Kolkata will have generally cloudy sky, minimum temperature 26 degrees Celsius, maximum around 32 degrees Celsius. In Gilgit, the minimum temperature was recorded at 19 degrees Celsius, while the maximum will be around 33 degrees. It is expected to have mainly clear sky, becoming partly cloudy towards afternoon or evening. Muzaffarabad may also see mainly clear sky. The place witnessed a minimum temperature of 19 degrees Celsius, while the maximum will be around 36 degrees Celsius.
U.S. State Secretary Mike Pompeo has said that Beijing is using corona crisis to bully its neighbors and militarize South China Sea. He said rather than helping the world during this corona crisis, the Chinese Communist Party is bullying its neighbors. The U.S. Secretary of State was addressing a press conference in London last night following his talks with British Foreign Secretary Dominic Raab.
We talked about how we've seen Hong Kong's freedoms crushed. We've watched the CCP bully its neighbors, militarize features in the South China Sea, and instigate a deadly confrontation with India. I want to take this opportunity to congratulate the British government for its principled responses to these challenges.
Mr. Pompeo said the entire world needs to work together to ensure that every country, including China, behaves in the international system in ways that are appropriate and consistent with the international order. Indian Cricket Board BCCI will seek government's permission to stage this year's Indian Premier League IPL in the United Arab Emirates. This was stated by IPL Chief Brijesh Patel yesterday.
And now an overview of today's newspapers. A study by the NCDC in the national capital is the top headline in all the dailies today, suggesting that the virus of COVID may be less deadly than thought. Hindustan Times on its front page headline reports, Sero survey shows 23% may have been COVID positive in capital. Tempering expectations on Oxford University vaccine, the Economic Times quotes the doctors saying vaccinating India will take at least 2 years. No Amarnath Yatra, first time in 150 years, writes the Tribune in wake of the pandemic. The Indian Express reports China common worry, India and US step up military intel ties. And finally, a story on the front page of Hindustan Times mentions about Amazon shares surging 7.9%, the largest single-day jump for an individual since 2012, under the headline, Jeff Bezos adds record $13 billion to wealth in one day.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi to deliver keynote address at India Ideas Summit today. Health Minister Harshvardhan says N95 masks with respirator valves do not prevent coronavirus. Appeals everyone to use triple layer mask made of cloth. Government extends work from home for IT and BPO companies till December 31st. Annual Amarnath Yatra cancelled this year due to COVID-19 pandemic. Flood situation deteriorates in Bihar following heavy rains. And US says Beijing is using corona crisis to bully its neighbors and militarize South China Sea. And with that, we end the morning news. Have a nice day.